Revaccination of persons later on for the pertussis is persons who have had seizures, is it contraindicated in them, or is that old thinking?
Yeah, no, that's old thinking. And so the only real contraindications to pertussis vaccine is if you've had anaphylaxis to one of the components at some stage. Pertussis, particularly in the days we had a wholesale vaccine, had enormously bad press. And many general practitioners used to use just about any excuse and actually not complete the course back then. It was the one that was most likely to have people not complete their course. But so long as you haven't had a response to the vaccine itself, there's no contraindication. It's the same with all of the others that have allegedly been associated with neurological disease. So there is some suggestion that maybe influenza vaccine can cause Guillain-Barré at the rate of 1 in a million or less. Such a low rate, very hard to prove or disprove. What we do know is that influenza infection itself is associated with Guillain-Barré at a rate of 100 to 1,000 times that. Now, if you've had Guillain-Barré after influenza vaccine, then we don't recommend you get it again subsequently. But if you've had Guillain-Barré without any relationship to influenza vaccine, then that's not specifically a contraindication itself to getting a vaccine dose in subsequent years.
Thank you.
How was it that Wakefield got published with such a small sample size?
Who would you like to direct that question to?
Anybody who's willing to answer.
I think people have asking that question of the editor of Lancet for a long period of time. Not only that, if you look at, he's now been deregistered. They've withdrawn the article. There are court cases everywhere. He's over here somewhere, because he can't be in the UK at the moment. There was a lot of money given to him by campaigns for that. The parents were paid. This was a study done at a barbecue in his backyard at the time, when people with a particular axe to grind turned up to see him, It is appalling if you look at the impact of Jennifer McCarthy, but the impact of Wakefield in the UK is even worse. Their MMR coverage rate dropped, to the mid 50%, and in some places, particularly the east of London, they've had massive measles outbreaks since then, with significant deaths. And so, he's done more damage than just about anybody in the history of the vaccination movement with his particular process. And there are still people who don't want to get the MMR vaccine because of Wakefield. Even in Canada, we get parents turning up wanting vaccines split and wanting to, have them in a different process because of their concerns with autism. And it's just outrageous, and taking his ticket off him, doesn't go far enough, I think, to cover the damage that he did.
Any other questions at all? Gina?
Paul, with the Jennifer Lopez kind of campaign, what evidence is there so far that kind of using the same kind of tactics as the anti-vaccine is?
Well, I think that what we need to do is have some impact. And this is something that we found particularly challenging in Canada, because Canadians are really polite. And so things that we've had that work in the US and work in Australia are more challenging to get the government to approve here. And so I think a good example is that in 2010 in Canada, the early focus groups about flu vaccine showed no one wanted to get a flu vaccine. They had lots and lots of noise about the pandemic. They thought it was overreaction. People either didn't like or were worried about it, but what everybody decided was that they couldn't be bothered getting a flu vaccine in 2010 because we had the pandemic last year, they were flued out, they were moving on. In New Brunswick, where I was at the time, they ran 2 ads to focus people back on influenza. They ran one ad, which was disgusting, and they're both on the Government of New Brunswick website still. It was a little child who taps at a computer screen and then sneezes into the screen, and your television screen's full of green googlies dribbling down the front of it. We got 150 complaints to the Minister about the ad, but I had 2 weeks of non-stop television justifying the ad about how bad flu was. And then we ran 4 weeks of an ad with a little child in a hospital bed. saying that vaccination is 90% likely to prevent hospitalisation. Vaccination rates in New Brunswick went up 10% that year. There was a slight increase in Nova Scotia because they got part of the ads because it was a combined TV, and everywhere else the coverage dropped below 20% because there was no campaign and people had enough of flu because of the pandemic. And so these things work because they give you an opportunity to do what we talked about today, to discuss the fact that vaccines are important because diseases are particularly nasty. And if you don't keep putting that in the public forum, all they get is the reverse. They don't see measles. They don't see a lot of other things, you know. And a lot of this is what we call the health belief model. If you don't believe you're at risk, then you don't want to do something to protect yourself. Now, I want to move away from vaccines to another group. I mean, we talked about HPV. We couldn't understand why the chlamydia rates just keep doing that, you know. What is it about children that they don't understand what a condom is? You know, and so no matter what happens, and no matter where you are in Canada, the chlamydia rates just keep going up. You know, and this is not, you know, a drug user issue or an Indigenous issue or something. This is, if you're under 30 and breathing, you should have a chlamydia test, you know, because the chances are that you've either got it or you'll get it soon. And the process, now we interviewed all these 15-year-olds in New Brunswick and asked them what sexually transmitted infections they were worried about, and they were all worried about AIDS, you know, they were worried about HIV. But they didn't know anybody with HIV. So they weren't worried about getting a sexually transmitted infection because they knew they weren't going to get AIDS, but that was their big worry. And so safe sex meant you're on the pill. You weren't going to get pregnant. The rest of it didn't matter. You know, one of them said he'd wear a condom if they looked particularly skanky. Now, you know, 80 years of obstetrics and I still can't pick skanky from non-skanky, so I don't know how he could 2 o'clock in a rave bar. But, you know, this was part of a process. You've actually got to convince them with vaccines and everything else that this means something to them. And while people are saying shock ads don't work and the rest of it, the reality is that they are getting inundated with all of this other stuff all the time. And if you're being Canadian, if you're out there being polite, you get no penetration into the actual marketplace.
Yes.
I just want to add that there's also a strong opposition group against Gardasil. That they don't believe that it should be given to children in the age of 12, 13 because they would be encouraging them to have early sexual intercourse. It's a bit like, you know, if you put on a seatbelt, you're going to drive your car faster. So it's, there is a very strong opposition group.
Dan, did you have a question?
Yeah, this is a question for Roger. So you were talking about Aventis, so in their way of dealing with things, and especially in the third world. So Aventis was doing some good things, and GlaxoSmithKline was doing some bad things. So first question is that sort of a general characterization of Aventis, or was that just one particular thing that they were doing versus GSK? And second, if it is general, what's the difference? And why is one behaving better than the other? Can you identify an underlying reason there for that unknown?
Well, the only evidence I have is just 2 case studies, right? So I don't know.
So
I wouldn't want to generalize from that. But the other question, again, I don't know how far I can go with it. I mean, there is such a thing as a company culture. I mean, it's well-known phenomenon. From management sociologists identify that kind of thing, and maybe that's what we're talking about here. But I don't know is the answer.
Can I just make a comment on that?
Yes.
I think what's happening extensively with third world vaccinology is that there's been a change in a lot of the policies, including from GSK. GSK is working with both Gavi and the Gates Foundation to get cheaper versions of their human papillomavirus vaccine, Cervix, on the market. You know, some people would cynically say that's because they had trouble selling a bivalent when there was a quadrivalent because they can't sell it in the developing world. They're working with Gavi to get a version to sell into the into the developing world. But what happened a lot recently is agreements from companies to license the intellectual property to developing nations like Brazil and India. And so a lot of the vaccines that we pay a lot of money for, and the same applied to things like the medicine for the pandemic flu. Roche provided the precursors to India for that. And so the deal is they're not allowed to sell back into the developed world. And so they want to still charge us $100 a dose or whatever, but they will now give it to Africa and various others at much cheaper rates so that they can assist with the third world, but still keep their shareholders happy and still sell it to us. So India will make it for India at $2 a dose or whatever. They'll continue to sell it to Canada for $100 a dose, but they're starting to actually, get with Gavi and the others to actually do a lot of that development. And I think, one of the great examples of that is that they've just released a conjugated meningococcal A vaccine to Africa. And the development of that was such that these vaccines, when Men B comes here, it costs us $100+ dollars per dose, in a 4-dose regime. It's a 20 cents a dose vaccine in the US. Same technology, same vaccine companies, but working with government to say this is the epidemic serotype in Africa, and they're going to save thousands and thousands of lives by the fact that the company has now worked with them to do it. So I'm not pretending they've become good corporate citizens. They're there to make a profit for their shareholders. But I think the last 5 years we've seen a real improvement in the culture of working with, particularly Gavi and the Gates Foundation, who actually develop vaccines for the third world, or give them the technology, while protecting their market share in richer countries.
Any other questions? Yes.
This question is for Janet and Dia. Why do you think that in eliminating many infectious diseases, we've seen such an increase in autoimmune disease?
Well, you probably already know the answer if you took my class, but for everybody else, because as infectious disease it decreases, our immune system also has less stimulation. So while there's no real, factual evidence, there's definitely a clear association between less infectious disease and an increase of disbalance in autoimmune diseases. Do you have any comments?
No.
Yeah.
So what should we do about that? Should we get our kids playing in the dirt more, or what?
Yeah, we don't need to be so sterile.
Open the window.
We don't need to be so sterile, but the connection to vaccination is we take out certain diseases from our population. But you can't just associate it with that. It's the fact that we spray Lysol in our rooms to kill 99.999% of the germs. The fact that we're all obsessively washing our hands with antibacterial soap, right? There's a lot of associations. So I wouldn't say that vaccination contributes to that as like a sole, source of decreasing our disease. But mentally and in our practice as citizens in a clean society, we've made things too sterile. So let's not get the infectious disease, but let's still keep stimulating our immune system to things that aren't harmful.
Well, and also the vaccine does stimulate your immune system as well.
Sure.
It's just doing so with a less harmful version.
Yeah.
This is a fairly general question, because a number of you showed a figure or a graph, well, it wasn't a graph, it was like a table, showing the decrease in number of cases in pertussis since 1934, for example. So now it looked like all of those were just absolute numbers. Of course, the numbers would be more impressive if they were reported per capita. So I was just wondering, why didn't you, or is that, or maybe it's just a suggestion to or at least kind of normalize those by per capita rates, because it is misleading otherwise. I mean, especially since 1934. I mean, that's a big difference.
I think that when you look at global totals, though, it sort of takes away some of that bias.
I mean, if anything, it's going to be more impressive because the number's going down, the population size is going up. The numerator shrinking into nothing, it's growing.
Right, yeah, exactly.
So it's going to be even more dramatic, actually.
Yeah, exactly.
In 1934 we had in Canada, what, 10 million people, 5 million people, you know, but a huge number of cases. And so, I mean, you'd be even more steep if you did it per capita.
Per capita, yeah.
Yeah.
Absolutely.
My question to the ethicists and the legislatures. I applaud all of you for the information you've given us and the value of education. I worry that some of the extremists will never believe any education campaigns. And the next step to that is where does society place the rights of the individual below the rights of the community? And talking about legislating the influenza vaccination for healthcare workers. Do we need to take it further and actually make vaccinations mandatory for attendance at a public school or attendance to a public place? Because as herd immunity drops, it's back anti-vaccination movement gains more ground. We as a society have the right to actually enforce vaccination. Where does that stand ethically and politically?
Yeah, I could speak to that, I guess. Because something that occurred to me as all this was going on. I mean, to be frank, it's a fallacy to claim that it's an issue of individual right. I mean, the way that classic liberal, ethical and political theorists, talk about individual liberty, right? It's in terms of an area within which you have the freedom to act and the freedom to choose, and government can't interfere, right? But the catch is that only covers actions which are self-regarding. In other words, actions or decisions, choices that have no effect on anybody except yourself. I mean, as soon as your action or your choice has an effect on somebody else, it's a whole new ballgame, right? You don't have that kind of preemptive barrier against government action. What comes in instead is a whole lot of other considerations about whether it's actually practical to try and make something mandatory, and whether or not you get more cooperation through education, or whether the carrot's better than the stick. But what's come from these presentations today very clearly is that if you choose not to vaccinate your children, it doesn't affect only your family. It has this cumulative effect on the whole population. So I think that there's something fundamentally wrong with framing it as an incursion into individual liberty. It's not. It doesn't meet the conditions under which individual liberty operates. Does that make sense?
Yes.
One thing to add to that, if immunization is mandatory, then it's really up to that country to provide the immunization for free. I mean, for instance, with Gardasil, it's like $350, like a 3 series of immunization. And the one for little kids for the rotavirus is about between $100 and $200. So these are things that, if the community is going to pay for it, that's in the United States. It was interesting for the immigration. For the last, I think, 10 years or so, they've had, no, maybe less than 5 years, they've made new immigrants, women under the age of 26 had to prove that they've had at least the first shot of Gardasil. And actually that was appealed by a human rights group that said that was really quite unfair. That why are you targeting people coming in who may be poor or through a disease which is not readily, I mean, it's communicable, obviously, but it's not like a respiratory disease which could affect a whole lot of people generally.
I want to clarify the healthcare worker situation. There are places on the east coast of the US where their healthcare worker compulsory program had get vaccinated or get sacked. And they've got coverage rates of about 99%. The Lay Clinic in Massachusetts and various others. What's been brought in here is similar to what happened in some of the other places in the middle of the US and Hospital Corporation America, which is if you don't vaccinate, for 6 months you wear a mask at work. And those programs in the US have produced 95% coverage, which goes up over time because people make a stand first and say, I'm not doing it. The and then they start wearing a mask for day after day after day, and they decide they actually don't want to do that, and then they go and get vaccinated, so it dribbles up to the same coverage. Coverage in Fraser this year was 31% in healthcare workers. They will not go and vaccinate to protect patients. And so, the introduction of this is you have to vaccinate or you have to wear a mask, not you'll get sacked, otherwise we would have fought the unions for the next 10 years. I don't think Canada will ever have a program to compulsory vaccinate children. There are huge inducements in other places. In Australia, every parent gets a lot of money for having a child. They're part of different child benefits. If your children are not vaccinated, you lose all that money. That's part of the process. Here, in a lot of provinces, we have what they call school entry legislation, which means you've got to prove when you go to kindergarten or the start of elementary school that your child is vaccinated. You must submit your records. Now, they don't force you to vaccinate, although there is a real process to try and catch everybody up at that particular time. But what happens is, as soon as there is any outbreak, your child stays home, because you are the portal of transmission of that disease. And so, and people like me are quite happy to declare every rash measles, so that all of those unvaccinated kids can spend 2 weeks at home, and their parents can stop work, and then they can reassess whether they really want to have an unvaccinated child or not at that time. And many of them actually decide, maybe I will vaccinate my kid if it means I have to actually parent rather than working. And so, I don't think we'll ever have compulsory processes, but there are a lot of steps that have been taken to try and make sure that there are spots to encourage the vaccine and to exclude them from risk processes if they're putting the public at risk. I don't disagree with what Roger was saying. I just think that there isn't a government in Canada that would actually, go through with mandating that particular process.
All right, being mindful of the fact that there is a puck dropping somewhere right now, I'll invite anyone who still has a question for our panel to stick around and ask it face to face. The rest of you, thank you so much for coming on this beautiful afternoon and sacrificing the sunny day. I really appreciate it, and please talk to everyone on your way out about membership in CFI. Thanks very much.